And the reason that we say this, the reason that we repeatedly say that countries have an ability to turn this around is because we've seen it happen over and over and over again. And it requires everyone playing their part. It requires strong leadership. It requires consistent messaging and people understanding what they need to do, what role they have to play. Following the advice of governments, keeping your physical distancing, cleaning your hands, wearing a mask where appropriate, staying home if you're asked to. All of these measures contribute to fighting COVID-19.
Could just add as well, this is, as I said, the first time we've dealt with this new and novel coronavirus, SARS-CoV-2, which causes COVID-19. So the assumptions that the disease would naturally be come in waves is an assumption that's based on previous pandemics with other respiratory viruses like influenza. I think what is clear is that countries that have implemented control measures have suppressed the virus. And when those measures to suppress the virus are lifted, the virus returns. And I think what is clear that pressure on the virus successfully pushes the numbers down, release pressure on the virus, and the numbers can creep back up. So whether we're dealing with second peaks within the first wave or second waves, in some senses is not the right question to ask. The question to ask is, how much pressure do you have on the virus? Do you understand where the virus is in your country? Do you understand the populations that are being affected? Have you got in place the necessary control measures to keep pressure on the virus? Because every single country where pressure has been lifted on the virus, where virus is still at community level, there's been a jump back in cases. And the question is, how effective are authorities at reacting to those increased numbers? And to what extent are communities empowered, supported, and involved in that process and playing their part in suppressing the virus transmission? Because we could turn this into an academic argument over second peak, second wave. I think that's not the right discussion to have. We need to keep pressure on the virus. Those countries that are pressuring the virus are succeeding. Other countries are struggling, and we need to be able to change the game.
Thank you very much, Dr. Ryan and Dr. Van Kerkhove. The next question is coming to us from Hong Kong, from Marianne Benitez of the Hong Kong Standard. Marianne, can you unmute yourself and please go ahead with your